Difference between stress and depression. Trigger alert. Did you know that 2/3 of those who commit suicide struggle with depression? A study by the American Association of Suicidology 2020 confirms the data. If you have been feeling stressed lately and continually losing interest in your favorite pastime or troubled sleeping pattern, you might want to check with doctors if it is actually stress or a sign of depression. Since there are a lot of commonalities between stress and depression, we often mix them up and cannot seek professional help until too late. Many people try to hide depression under the veil of stress because either they are unaware of the difference between the two or avoid being referred to as a person with a mental disorder due to society and peer pressure. It's high time we not only understand that though stress and depression have few commonalities, but they are also different from one another. Depression being a mental disorder doesn't qualify you as a psychopath. Let's understand what these two are and the difference between them. What is stress? Any emotional or physical tension that humans experience when under pressure or unable to cope with a given situation. It can occur from any event or thought that makes you feel angry, frustrated, or nervous. It's your body's reaction or coping mechanism to a challenge or demand. A little stress can be beneficial and motivating. For instance, if you're worried about a deadline to complete, the stress motivates you to accomplish your goals timely and efficiently. However, when this stress starts affecting your health, it becomes a matter of concern. Some of the warning signs of stress are difficulty in sleeping or staying awake, headaches and body aches, feeling anxious all time, falling sick often, lack of concentration and difficulty in completing tasks at home or work, finding tough to remember everything. A change in eating habits, feeling angry or irritable. What is depression? Depression is a mental health condition. Major depressive disorder, MDD, commonly known as clinical depression, is one of the most common mental disorders worldwide. The effects of depression can be long-lasting or recurrent and can significantly affect a person's ability to function and live a normal life. Life events such as childhood adversity, loss, and unemployment contribute to and may catalyze the development of depression. Some of the warning signs of depression are loss of interest or pleasure in daily activities, sleep disorders, not liking food or change in appetite, lack of energy and concentration, lacking self-worth and confidence, feeling hopeless or guilty, anger and rage, suicidal thoughts, stress versus depression. Here are a few points that can help you distinguish between stress and depression. Depression is a mental health condition that can make everyday activities a struggle. It's much more intense than feeling stressed. People who experience depression often lose interest in activities they used to enjoy. Lots of people can feel stressed or low during difficult times. However, these low moods can improve after a short period, whereas depression can last longer. Depression is more than just feeling overwhelmed for a couple of days. It can last weeks, months, or even years, especially if it goes undiagnosed or untreated. Whereas stress tends to resolve if life events change. Stress tends to have an obvious trigger, while depression can hit out of nowhere. Stress is related to life events, whereas depression can happen even if life seems fine. Depression is linked to unresolved past events, whereas stress is related to current events. Stress can cause depression or anxiety disorders if left untreated, whereas depression can cause suicidal thoughts if left untreated. Stress leads to adrenaline highs and crashes, whereas depression leads to fatigue. Stress is socially acceptable and even encouraged, whereas depression still bears social stigma and is taboo. Stress at very high levels has a risk of heart attack, whereas depression at high levels has a risk of suicide attempts. Low stress levels are sometimes positive as they motivate you, whereas low depression can still be debilitating. If you are stressed, you may experience sleeplessness, headache, palpitation of the heart, chest pain, stomach upset, and the like, whereas, if depressed, you may experience dangerous symptoms such as abuse of alcohol or drugs and suicidal thoughts. Ways to deal with stress and depression. Exercise. Physical activity releases endorphins, the feel-good chemicals in the brain. Endorphins also improve your ability to sleep, which in turn reduces stress. Deep breathing increases the supply of oxygen to the brain and triggers the body's relaxation response, which promotes a state of calmness. Meditate. Meditation allows you to focus your thoughts and calm the stream of jumbled worries, clouding your mind and causing stress. Laughter therapy. Getting together with good friends and laughing can reduce stress. Laughter decreases stress hormones and releases endorphins to promote an overall sense of well-being. Develop a new hobby. Setting a goal of learning a new language or hobby helps build confidence, which can help you deal with stress. Avoid alcohol and drugs. Many people use alcohol or drugs to find temporary relief from stress, but in the long term, they will only make your problems worse. Community service. Helping others in need through volunteering or community work can help put your problems in perspective. The more you give, the less stressed you'll feel. A word of advice. Do not suffer in silence. Stressed or depressed, you must reach out to people you trust and speak about your feelings and current state of mind. If possible, seek professional help. Never be ashamed of suffering from depression or any other problem. Depression, in particular, is not a sign of weakness, and when you seek help, it reflects your will and strength to fight back. The first step toward feeling better is telling someone that you are struggling. So speak up and fight with all your strength for a better and healthy life. Thank you for watching the video. Please like, share, and let us know your thoughts in comments box.